And I think, yeah, you talked about using photos to, draw attention to systemic structural issues, but also how to address those issues. And that really is our next research question, which I'll pop into the chat. So for the panelists thinking about your work now or more generally as well, what do you see as key opportunities for the study for research to address men's mental health in a way that's responsive to equity concerns? Or put another way, like how can we design research in a way that seeks to redress inequities? Anyone jump in to go first?
I'll start us off.
Thank you.
So I think, first of all, I think many of us are engaged in community-based participatory research. And I would always argue for involving the community. So in this case, I think men need to be central to central to and involved the development and implementation of any sort of research, policies, or programs related to men's mental health. And I say that as we have three women on the panel tonight. But truly, I just think this approach really ensures that men's perspectives and experiences, are taken into account. And I think it leads to more effective and appropriate programs and interventions. I would also add, an intersectional lens is necessary, and I think people throw around that concept without, really truly engaging in that. So, making efforts to understand the various vectors of one's identity to really see how they experience the world, or how that influences the ways in which they experience the world, in which they are sort of perceived by the world. And again, I think all of these questions have really addressed that men's experiences of mental health are really influenced by factors such as race, ethnicity, sexual orientation, socioeconomic status. So I don't think you can look at men's mental health without taking an intersectional approach. And I think we need to consider this, not only in, research and the ways that we engage in research, but how, policymakers need to take this into account when they're informing and developing policies, and mental health practitioners really need to really, centralize this in their delivery or provision of mental health services for men.
Well said, thank you. And we do have three women on the call today, and we are lucky to have you three, so thanks. Jennifer, did you want to test out your internet? And maybe we'll go to you next.
Sounds good. Well, I second pretty much everything Francine mentioned. In addition to what she shared and what Sarah spoke to earlier was about the importance of policy. And, a lot of, as we said, a lot of these determinants of mental health are structural and need to be addressed with policy along with mental health services, and thinking about, the individual in the larger context and how we can continue to change that context for more equity. The other thing I would say is just about, I was also going to talk about the intersectional lens, but that, I taught a psychology of women course when I was in graduate school, and really only included a couple of weeks of psychology men and more like psychology of gender at that time. And I know things are changing, but we really didn't receive a lot of education about men's mental health. And I think in some ways it's overlooked, or in some settings that are doing a good job with this. But I also see it in humanitarian settings. Men's mental health is really not addressed. So it's starting to shift a little bit, but when I did my first project, maybe 10 years ago, in sub-Saharan Africa, there was so little written about men's mental health and substance use in particular. Now people are talking a little bit more about, alcohol use in men in sub-Saharan Africa, but still not a big emphasis on services and what we can do about it. So that's, I think, the next step is training, but also advocacy for inclusion of men in this conversation. I have some anecdotal just communication from a colleague who does similar work to me in refugee settings. And he was saying that, initially they had some programming for both men and women, and they had, men kind of showing up to some of these community programs, but, drinking and just kind of being sort of disruptive. And so they made it for women only. And I think the opportunity is to consider, but thinking about how we can best respond.
Great, thank you. And we heard you perfectly well that time, so that's great.
Okay, good.
Yeah. And I think that circles back to our conversations at the start of the panel too about multiple axes of intervention across like policy, services, and advocacy activism in a way that's inclusive. So thank you. And then I think we'll go over to Sarah, please.
Yeah, thanks. I guess my answer here is a little bit different because in the New Zealand context, we are a small country. So we are 4.4 million people. And so to understand the mental health inequities amongst men, we first need to know what they are. And there's a lack of data in New Zealand about what those inequities are. So we do know from public health data that inequities do exist at a population level, but they're largely ethnic inequities between Maori, non-Maori, Pacifica and other groups in New Zealand. But we know very little about the equity concerns among other groups. Thinking about migrant men, unemployed men, sexual minority men, we just don't know a lot here in New Zealand about those groups. And it's quite timely. Last night we had our census, our first census in 5 years. And for the first time, they've included questions around diverse sexual and gender identity, which is really quite a first for New Zealand. So I think it's good when governments are starting to include some standardized survey questions, I guess, particularly at a population level. So as researchers, we can start to use that data and start to explore where the mental health inequities lie. So in New Zealand, we probably are a little bit behind Canada and Australia in terms of what the landscape of those inequities are.
Yeah, I love that point about first identifying the inequities and tracking them and not getting ahead of ourselves. And I think even, for me in Canada, when we are, as you said, ahead of New Zealand, which I don't know, there may be differences. I think even when we are focusing on intervention, we need to be coupling that with research. So I think that's a really critical point in surveillance.